Hi, my name is Benjamin Duran, and I'm going to talk to you today about the exercise demand and the effects it has on the synthesis of plasma leptin. Leptin is a hormone that controls feed intake and energy expenditure. Leptin is synthesized by adipocytes, and body fat or adipose tissue is the main site where leptin is synthesized. The study I'm going to mainly focus on today was a study conducted using 37 horses. All of them were Iberian horses. There were 22 geldings and 15 stallions. These horses ranged in age from 5 to 19 years old. The horses were kept under the same conditions and fed an individual ration that was developed by the trainer and adjusted every 2 weeks according to the measured body weight variations and the workload. The body weight variations were based off of the previous weights of the individual horses. The horses were also monitored by body weight and body condition scoring. The horses were kept in the same conditions. Therefore, there should be limited environmental changes that could affect the results. This study was conducted over a year period from October 2008 to September 2009. There were two distinctive exercise periods, the training period and the show period. During the training period, which was 6 months, the exercise intensity was determined by a heart rate monitor and a global positioning system. The horses started out training 1 hour per day for the first 3 months and then gradually increased to 2 hours per day for the remaining 3 months. The training consisted of working in all gaits, walking, trotting, cantering, and galloping, or the training was rehearsing the show routines. The show period had a workload that increased as the months progressed. During this period, the horses had no rest days and performed 2 to 3 times a day. The shows had a warm-up period before and a cool-down period after each show. The shows themselves were a historical reenactment of a medieval battle and vaulting on a lunge. Blood was collected by every month between 6 a.m. and 8 a.m. The blood was collected from the left jugular vein into a vacuum tube containing the anticoagulant tripotassium EDTA. The blood samples were centrifuged immediately and then frozen at -20 degrees until assay. Assay is the testing of a sample to determine its contents. The results from the study with the Iberian horses was surprising. Plasma leptin concentrations during the training period were higher than the show period. The body rates remained steady. The energy intake increased throughout the training period through the show period. As the energy intake increased, so did the energy requirements. However, one would expect the plasma leptin levels to increase during this time, but it was quite the opposite. As you can see in figure 1 on the next slide, when the horses changed over from training to showing, there was a drastic decrease in plasma leptin levels. Here on figure 1, you can see from March to April, when the horses were changed from training to showing, there was a drastic decrease. This drop was roughly 50% during a time when energy intake was increased by 12%. One can conclude from this that plasma leptin levels are independent from energy intake. In this study, they compared the plasma leptin levels between the stallions and the geldings, and saw a slight increase in the stallion leptin levels. However, it was not a significant amount. Another study focused on interval training versus continuous training. This study resulted in showing that the continuous training results in a higher leptin concentration compared with interval training. If this type of training was applied to the study with the Iberian horses, then we would assume that the group being trained continuous would have higher leptin levels and a more significant drop in leptin concentrations during the changeover from training to showing. Through all the research done on plasma leptin, the researchers are still trying to figure out if a difference in exercise causes a change in blood leptin levels. However, there has been no significant correlation between exercise and leptin levels in the blood thus far. This concludes my presentation. Thank you.